Kwa hiyo kuna mose inakuwa smart.
Yo, what's up guys? My name is Wachera Gikonyo. Welcome to Showtime TV. This is My Health is My Wealth. Na kama kawaida, this is where we talk about our health. Last time we talked about PEP and PrEP. And again, we have Madam Sharon with us today. Karibu sana.
Asante.
Yeah, those who are watching us live on Facebook, make sure that you have commented below, like, and of course share this link. And pale YouTube, make sure that you have commented. Ask as many questions as possible. Subscribe. Let us talk about contraceptives today. What method of contraceptives are you using today, or what do you know about contraceptives? So today Sharon is going to tell us more about it. Karibu sana.
Asante sana.
Yes, for those who are joining us for the first time, please tell us what you do.
I'm Sharon Wateri Macharia, mentor mother of Magana Health Center.
Yes. Oh, karibu sana. So as I've said, as I've mentioned, we are going to talk about contraceptives today. So kindly start by telling us what contraceptives of I think family planning. Contraceptive family planning. Yeah, you can maybe explain to us briefly what it is about.
Family planning. This is how do you the number of children you want to get, the spacing, and the spacing, the plan that you will make, you together with your husband or with your sex partner, the planning of kids. It's not like na hii kuna mwezi pata watoto wengi.
Yes, sure.
So there are methods that we use for ensuring that the process is good.
Yeah, sure. And I know that they are the health of the woman too, and the man too can also affect family planning. So maybe you can tell us what methods of family planning can we choose, to control the number of children you'd like to have.
Okay, there are natural ways, and there are ways where you use contraceptives and other different methods. The natural way, maybe it's when the lady uses the calendar.
Yes.
Or the man uses the withdrawal system.
Okay, that is the natural.
Yeah.
Okay, so the calendar. I'm sure many women out there know about the calendars that we download to check on our periods, our ovulation, our safe days. One app that I use is Flow. I don't know which calendar you use, but there's one that is called Flow, which is very, very good. You can download it, FLO. It can help you track your period, your ovulation, so that if you don't want to conceive, if you want to maybe, for example, plan for an event on, maybe for example you want to plan for an event, you can check on the calendar, check which day the period is going to come. So it's a good app. Okay, so you talk about the natural methods is like use of the calendar, where the man also uses the withdrawal method. How effective is that?
The withdrawal method, it's not that effective because the man might be so
heated up.
So, and maybe he forgets. So instead of that, that's why we advocate on condom use, because when sex is sweet, that's when the marriage clicks.
Yeah. Sometimes it's a little bit hard. So and then of course I think also the precum for the man. There's that fluid that comes out of a man before the actual especially when the man is erect, right?
Yes.
So can that carry sperm? Is that enough sperm to make a girl pregnant?
Yes.
Oh, really?
Yes.
So it's not very, very effective.
It's not very effective as long as the penis has penetrated in the vagina. Whether she maybe, you know, there's a time in a certain hospital. Allow me not say the word of the hospital or because of privacy. So the lady, a girl came. She proclaimed to be a virgin, and the nurse in charge was so curious. What happened? You're pregnant. And then the girl never knew what sex is. So he said that hakuingia sana, alingisha tu kidogo. Now when the man ejaculated and the sperm went to and fertilized the girl, she became
she was a virgin?
Not really virgin.
Oh, okay. I don't know whether, you know, if you can be half a virgin.
Okay, you know, from the girl's statement and the way our gynecologists, our midwives check, the vagina was penetrated a little.
Oh, okay. So the hymen was like half broken, right?
Half broken.
Oh, okay.
But you see, the man, the sex organs and the organisms of the man had already.
Yeah.
He had already ejaculated, and the girl ejaculated, and the girl got pregnant.
Oh man.
Yeah.
There's sometimes we're being told, somebody just told me like a long time ago, I think when I was in primary school, that even sharing towels, you can get
those are the myths.
The myths,
everything behind even sex.
Okay.
You know.
All right. So you talked about the natural method. So we withdraw, use of calendar. Yeah. So let's talk about the artificial, right?
Yeah.
Artificial methods of family planning. Artificial
methods are the pills. It's many ladies know about them. Implants. There is pills. Implants. IUD. And pills, implants, IUD. Yeah.
Okay. So
yes, vasectomy and tubal ligation.
Oh yeah, men. We almost forgot the men have also artificial ways of family planning, which we shall talk about it. And many men don't want to use this. I don't know why we're talking. Men out there, pale hivi kwa comment section, mention why you don't like using the artificial method of contraceptives, and is it really fair for women? But that's a topic for another time. Actually, today, yeah. So let's talk about the pills. Yeah.
Tell us the depot. It's the other family.
The depot. DEPOT?
Yeah.
Oh, okay. You should tell us that.
Depot, DEPO.
DEPO. Oh, okay. So let's talk about the pills. Tell us just a little, just touch on each one of them. Tell them briefly what it is about. So let's start with the pill. Okay,
the pills, these are they are short-term method of family planning. So you should take it daily. You should take it daily, not the way in our villages, in our schools, in our teams, where we advise other girls. No, you know what, or women, we tell them take the pill when your man is coming. No, it doesn't work that way.
Okay.
So you have to take the pill for 21 days, and then there are other 7 pills when you're having your periods. And
okay, they are normally like different colors. I think they are like yellow, red, or what?
The 7 days pills.
Yeah, the one they take when one is on the period.
Yes.
Yeah, okay.
And it is iron coated to help so that you can recover the iron that you have lost when you are menstruating.
Also, it's also good to to bring back the iron.
Yes.
But it's you've not told us about the hormone. That's a hormonal one. It affects your. Tell us about the hormonal. Yeah, so it means that the ones that are hormonal, the pill, you're going to tell us in these family planning methods which are hormonal, which ones are not. Okay, so how effective are they? How effective are they? What if I miss a pill for a day? I definitely get pregnant.
Not really, if you had religiously taken the other pills. So, and it's usually it has even the dates.
Okay.
1, 2, 3, 4, 5, 6, like that. And the process to follow.
All right.
Yes. Okay. So that when you can know, have you missed the dosage? Yeah.
And last time you talked about the PEP and the PrEP, where you have to take them at a specific time. So this one you can take at any time.
For me, I usually advocate for specific time because of the way we train our mind. Because today I take it at 1, tomorrow definitely I will forget.
Yeah.
The other day I'll forget. And then I remember, my man is coming. Continue taking.
Okay.
I start panicking.
Yeah. So just one quick one about the pill. You said that they are iron coated, right? So for example, if I have a problem with my hemoglobin or iron, I can just pop one. Even if it's not like my method of contraceptive, can I just swallow it as a way of bringing back the the iron in my body?
Yeah, they are supplements.
Oh, they are like supplements. Okay. Okay, but you seek medical advice, right?
First, seek medical advice.
Okay. So you talked about that's the pill. Let's go to the injection. You said the injection.
Yeah, the injection.
Yeah.
It's a 3 months term. Family planning. It's also a short term method of family planning, where you after 3 months you get injected.
Okay.
Now you go and get your dose. Because you are usually injected the left side if you're right-handed, and the right hand if you're left-handed.
Oh,
yes.
Okay. Okay, so how long can I get pregnant after like I withdraw from these two methods of contraceptives, like a pill and the injection?
And
so after like I said, I'm done with this, so how long will it take me to get pregnant? Because some people will say that I was using the injection and now I'm trying to get pregnant and it has taken me years to get pregnant. Or it depends on individuals.
Yes, sometimes okay. Mostly it depends in individuals, but for pills it's immediately.
Oh, immediately.
Because it's this pill you're taking it daily. So the dosage, you're limiting the dosage of the pill. You're the one who's managing it. So it's immediately. For the injection, you may have some delays.
How long?
You may have maybe 1 month, 2, or even more, according to your body now. So we advocate and we say go visit your gynecologist or your midwife. The nurse is there in the family planning department, and you'll get clear information on family planning and what should you do so that you can regain your fertility. Okay,
so that is this is a briefly about the pill and the injection. But if you want more information, I think you are going to tell us about the facility where people can come and visit you. Let's go to the implants. Yeah,
the implants. There are 2 types of implants. There is 3-year. The 3-year plan implant and the 5-year plan implant.
Yeah.
Yes, and there are long-term methods, which most of the ladies like. It's placed in your underarm.
Which arm? Like any?
If you're right-handed, it's the left.
Okay.
If you're left-handed, it's the right.
All right. So that actually where your hand is with the place
the
where
underarm.
So it actually affects whether you're left-handed or right-handed.
Yes.
If it's put wrongly, you definitely get pregnant.
We actually say, you see, when you're doing your work, you make the hand so active. Ukifua, ukienda kuchota maji, ukienda kulima, unaona kuna a lot of commotion, and maybe unaweza ganda. Maybe umeweka hiyo siku.
You can get numb.
You can get numb, and sometimes your day-to-day duties you feel, and that's not what you want. You want you continue doing whatever you do in a day-to-day basis.
Okay. All right. So if I have the implant and I want to get pregnant, so it will just get removed. Right? Is it like a long process to remove it? I think it's like put inside kabisa. Like a surgery or something?
Micro surgery. Micro, because even you feel it.
Oh, you feel it.
You feel it.
We tell guys, sometimes we find guys saying hi and then they're like trying to touch your arm to check if you have it. That's a friend of mine who told me that. Okay, so we looked at the implant, the pill, and the injection. So we move on to the next one. That's the IUD. IUD,
And one thing that I forgot to say let me first say about IUD, and then I summarize the information that I wanted. IUD it's a tissue coil. Most of us call it coil. It is inside. It's non-hormonal. It doesn't affect your hormones, and it's the best but there are some conditions. Yes.
What conditions are there?
The conditions are you be a one-man girl.
A one-man girl?
Yes.
Okay.
Don't have so many men, so many sexual partners because of the infections.
Oh.
It's inserted in your uterus. Yes, and in your cervix.
Oh yeah, the T-shape that has a string, right?
Yeah,
and I know that it has like a 5 years. There's another one for
10 years.
Oh, 10 years.
Yeah.
So if a man has many sexual partners, that girl
The
is
lady.
The lady. And what about the man?
For the man, we also advocate for faithfulness.
Yeah, either way, but for a girl, he should be very, very careful.
You should be very
to avoid
careful,
infections.
yes.
And how also you use the bathroom or something. Okay, these
just myths and misconception. Just be clean.
yeah, sure.
Or wash your innerwears correctly, well,
and dry them out.
Yes, and dry them.
Yeah, sure. Okay, so these are the female methods of contraceptives, right? And I think you should have also mentioned there's condoms too.
Yeah.
That applies for both.
Oh yeah, applies for both. There's a female condom and a male condom.
Yeah, and an emergency contraception, the e-pills.
The e-pills, they are not contraceptives, they are emergency.
Oh, okay.
So you can't take them like the POPs or the COCs. The POP is progesterones. The pills that we take.
Yeah.
You can't take the e-pills that way.
Okay.
Because it's a high dose that you're getting in your body, and no wonder most of the girls after a long period of time and they get married, they start complaining, oh, I'm not having kids
because of the e-pill.
Yes.
Okay, so it is not advisable for one to use. I think the doctor who came here from Marriage Stops, he told us that you're supposed to use it like at least twice per year, right?
Twice per year.
Yeah, that's the most healthy. But and if you can, you avoid it at all costs because it has a high dosage of hormones and stuff, and it can also cause an ectopic pregnancy. An ectopic pregnancy is when the baby, instead of the baby moving to the womb, it grows in the fallopian tube, which can lead to the endangering of the child and also the mother. So it's good that out there we be careful and let us use these other natural or artificial methods of family planning. Exactly. So now we move on. We're done with the female ones, right?
Yeah, for the female condom.
Yeah, for the female family planning methods, I think we are done with almost all of them.
The tube ligation.
Yeah. What's that?
Tube ligation. This is the method of family planning where your fallopian tubes are cut.
Oh, they are cut.
Yes.
So this is like permanent, right?
Yes, it's permanent. These are permanent. They are short-term family planning, which are reversible. They are long-term family. There is a short-term family planning, which is the injectables, the depot, which is not reversible.
The depot.
It's called August. Nikiako August, I'm supposed to stay for 3 months without
hiyo huwezi tolewa.
So siwezi hapo katikati niseme nataka mimba, haiwezi kuwa reversed. It can't be reversed. But for the pills, I'll just stop taking the pills. For the implanon, I'll just go and get removed. For the IUD, I'll just go and get removed. They are reversible, even if the period is not done.
Okay.
And now there's the tube ligation. Tube ligation, it's not reversible. It's not. And that we advise the person who have decided to have a tube ligation, have a stable mind that you don't want any other kid. Yes.
And what about the removal of the uterus? The people, what is it called?
Due to an infection?
No, it's mostly because of the fibroids or.
That's because of the even.
But there are women who actually prefer that as a method of family planning. I don't think anybody would want that from themselves.
Not really.
Okay,
because the uterus is a very. We don't see it, but it's a very, very good thing. A woman.
Yeah, it actually, it kind of like even forms the structure of a woman. So even if you look at the structure of a female body, female reproductive system, the uterus is there. It actually forms the body of a woman if you look at it structurally. So tube ligation, right?
Yeah.
It's cutting the fallopian tube.
Yes.
Damn. Is it like really, so meaning your period, no more ever again, and that's it?
Your periods, maybe you will be getting some spotting because the maturing of the ovaries is still continuing.
Yeah.
So
but
you get
your tubes, okay,
yeah, it's so you might spot.
Okay.
Yeah, and most of the ladies who advocate for tubal ligation in their 40s, 45.
Yeah.
You see. So even their menstrual period, it's cut short.
Yeah. Okay. Oh, okay. So I didn't know about that one. But we've talked about the female family planning methods. We've looked at natural and artificial ones. We've looked at the pill, the injections. So we're going to take a short break and we're going to look at the male family planning methods. Guys out there, is it okay do you feel that it's okay for you to use family planning instead of your woman using it? You say, last time you used it, let me now use it today. So how many men are willing to do that? Pale comment section, Facebook, YouTube, we shall be reading your comments. Stay tuned. This is My Health is Your Wealth with me, Wachera Gikonyo. I'll see you.
Do you want to feel free at least sometime? But sometime you don't know where, when, how. Worry no more, enjoy the finest luxuries. Without the hustle of, who will be driving, who will drive back. Specs Tours will worry about the drive. Books your car now, 5-seaters available. For 5,000 shillings 6 hours, 7,000 shillings 12 hours, and finally, 10,000 shillings for 24 hours all inclusive of a chauffeur. Call us on 0112 175 140 or 0740 509086 to book now.
Welcome back to My Health is My Wealth. This is the second segment. We are looking at contraceptives. We're looking at the family planning methods. We've already touched on the natural and artificial methods, and we've looked at the female methods, the artificial methods of family planning. So right now, let's get to the male contraceptives, family planning. But pale hivi mtandaoni, let us read what you have to say. We have Simon Rockefeller. Thank you so much, Washiro. Men refuse to have a vasectomy because in case of a divorce, a woman carries the children and maybe the relationship is beyond repair. The man has to get other kids. Okay, so Simon pale anasema ati men refuse to have a vasectomy. We're going to talk about what a vasectomy is, because if the woman moves on or leaves you, the man is left without having kids, and wewe unaendelea kupata watoto. So let's move on to the male artificial methods of contraceptive.
Okay, the first one is the condom use.
Yeah.
The male condom.
That applies to both, right?
Yes, and now the other one is the vasectomy. Yeah, a vasectomy is cutting the supply.
Yeah, like the testicles?
I know.
What?
In a male organ, there's the urethra.
The urethra that, transports the urine and the sperm.
And the sperms.
Yeah.
So it's kind of blocked. So the male organ will still do the work that it does. It urinate and also erect.
Wait, the urethra is supposed to carry the urine and the sperm. So if it's blocked,
No,
are you talking about the that tube called the endometrium? What is it called, guys? What is it called? That tube. Okay, it's just simply blocking the sperm to get it. Yeah, I get it. Just to get the sperm not, like zitakuwa multiply like in azizipita. Okay.
Azizipita.
And is it reversible?
No, it's not reversible.
Can a vasectomy fail?
Yes, it can fail. And due to some things, either you have to have a lawyer, you have to sign a contract in case of reversal, maybe.
You say it's not reversible.
It's not reversible, but sometimes it happens. Maybe you never followed the rules. There are rules you're not supposed to do. Maybe you're not supposed to have sex between this period, like the ladies one. Okay. So maybe if you mess around and then maybe you impregnate your lady, you go accusing the person who did it, you never did it right, you never those complaints. In order to safeguard the gynecologist and the people who do family planning for the vasectomy for men, there is that you are told these are the risks.
Okay.
And not everything is 100%. So the percentage is 97.
97. Oh,
so maybe you might be the 3% person, so it won't work for you. And if it won't, before there are so many tests that you're supposed to be done in every family planning. So that we can curb the severe signs and symptoms, the severe effects that may come later.
Okay, so just a quick one. I don't know if this will sound dumb, but when a man has unprotected sex with a person, when a HIV negative man has sex with a positive woman or whatever, so where does the HIV virus pass through? Does it go through the same place where the vasectomy is done, but does a vasectomy actually prevent you from getting HIV? I don't think so, right?
No, it doesn't.
Okay, so it just goes the HIV is absorbed directly in the blood, right?
Yes, and it's passed through body fluids. The sperm is the thing that will not. It's the only organ. Okay, I don't know to call it an organ or something, but the man will still ejaculate.
Oh, so those also still have like wet dreams and stuff. Okay,
but the sperm is the sperm is not.
The sperm is the one that moves. So the semen is the one. The semen is one that comes out, but the sperm is blocked, right?
Yes.
So just blank shots.
Okay.
Blank shots. All right. So let's first of all, before we go on, I don't know if there's any other male contraceptives, or you're going to like the Amen Bank says, near to the world. It is Showtime Africa. Thank you so much. Liwa Narumoru. Nyeri locked. I've learned a lot today. Live long Showtime. Thank you so much. Emily Mokami pale hivi anasema tuko ndani ya show. Asante sana. We have again Emily Mokami asks, does a vasectomy change a man's libido and desire to have sex?
No.
So bado kama wewe ni tiger unabaki tu pale hivi, does not affect your libido. Thank you so much for that question, Emily. So let's move on to the next male contraceptive. Do they have like pills?
No.
Oh, they don't. But I don't know. There's somebody who told me that there's a pill that is normally popped by men for contraceptives. And let me add, but it's something very new.
It's in sampling. It is not yet gazetted.
Okay.
So it's in the sampling process.
All right.
When the government want to release something to us, first you have to get samples. This sample, they do the investigations, they see the results, and when they get the results, they will still do the same. And then if it's legit and if it's good for human consumption, it's released to the rest of them.
Okay, all right. So let us look at the effects of contraceptives, and we are also going to look at the psychological part of it, especially for a woman, because we see that most of them apply to women. How do women feel psychologically when they are being told, "Oh, I cannot use a condom. You have to use this. If you don't want to get pregnant, then you have to use this." How does it affect them psychologically? And are most women willing to have these contraceptives? Let us also talk about the physical effects of these contraceptives. Nikki, meza hizo pills zitaniaffectaje physically?
Okay, psychologically, we advise and we advocate, come with your man.
Yeah.
Come with your man to the clinic, to the family planning clinic, so that you can discuss. You, the nurse or the gynecologist, and your man, so that you can discuss the three of you, which is the best method according to you, according to your health status, and then is the man ready to support you? Because family planning, it's not my thing. I'm not alone. I have to have my man. Sitaki nifanye family planning alafu my man will be like, cause hajui niko under family planning analita barren. You see the effects that happens later, and the myths and the misconception behind family planning.
Yeah, actually it's going there, because some people will say that, oh, family planning will cause cancer. Is there a family planning method that causes cancer? Let us first of all clarify with that, because some people will be like, oh, she got cervical cancer because of the family planning, or the coil will also, I don't know, you can get pregnant when you have the coil, and it can press the baby's head, and the baby will be born abnormal. Some will say that, oh, family planning, some will say hallucinations. There's so many myths and misconceptions, but are they really true? Especially the cancer one. Let's clarify that today.
On cancer, not really.
There was a time the 3 months injection was ruled out. I don't know if it was true, but there was a time it had been stopped some years back. I don't know how true it was, but I heard that it had been stopped because it had some effects. I think it's a certain hospital that was supplying the wrong dosage.
Yeah.
But is it really true that it causes cancer?
Not really, and that's why there are some tests that have to be done, so that the nurse or the gynecologist atajua ni gani mzuri kukupea.
Okay.
Yeah.
All right. Okay, so the clarified, it does not cause cancer, but these contraceptives, you can get HIV and AIDS. Do not prevent you from getting STIs and HIV and AIDS, right?
The only contraceptive and the only family planning method that it's a double thing. It's the condom.
It's the condom.
It's just only the condom.
Yeah, it's only the condom that can prevent you from getting HIV and AIDS, and also from getting pregnant.
Yes.
Okay, so the psychological one, we have been told you visit the gynecologist with your man or with your partner, discuss, hey baby, are you okay with this? Can I help you, or what do you want?
And what are the results?
Yeah.
What am I expecting?
Exactly. Yeah,
because,
exactly.
Like the depot, the injectables, most of the ladies say that their sex desire
goes down.
It's down,
more
goes
physical.
Down. Yes. And you know, it's psychological.
Yeah,
man amekuja home anadai alafu kale
stucky. Yeah.
It will bring issues.
Yeah, so it also causes, it can also bring problems in marriage, and it's good that men understand that, especially these hormonal ones, one effect, I think it's physical.
Yes.
It can lower the sex drive of a woman.
Yes, and
maybe
the esteem also.
And the esteem. Yeah. Talk about the physical effects that we look at, all these things that probably can be problems in marriages. Mwanaume anafikiria siku hizi unani cheat, but it's not the case. So let us talk about those effects.
Okay, maybe some ladies get acne, the pimples on their faces. Others get so plump. Others get slender. Others get migraines. Others, I don't know if it's a positive or a negative. Sometimes their periods, they stop receiving their periods. That's another side effect. Another one is
lack of appetite, or too much appetite. Is there? Does it affect your appetite? You start eating a lot.
Yeah. Not really. But maybe sometimes the first times when you have to make or collect appetites, because it's hormonal.
Or in sporting too.
Yes, and sporting, and if any effect prolongs. Seek medical advice.
Yeah, sure. Because there are, and actually it's good that you also understand that these effects happen to different individuals. Don't be like, oh my god, my friend just put an implant and she got slender, I want to get slender too, you go put it. So this, and
then you become
exactly.
Yeah, so bitter with yourself.
Yeah, but these side effects don't always have to happen. Yeah, there are people with different bodies, and they'll be like, you put contraceptives and they're still okay. So we talked about something about the libido and stuff. So which are some of these, mention maybe some of these contraceptives that may lead to low libido, because that might be a big problem in a relationship. I think that's what can affect a relationship mostly, low libido in a woman. So which ones are these?
Injectables, the 3 months injection, because it's unaweka dose mingi sana kwa mwili yako in a process once.
Oh, so a lot of dose is put in your body and then it processed once. So that one can lead to low hormones.
The hormones you'll be like your sex drive is no longer there. It's no longer as maybe high the way it used to be. Yes, and some even it's higher. You see. Some, if it is in some ladies you get the libido is low, and others
it's really high. Okay, so another quick one, breastfeeding. The people who say that breastfeeding actually is a method of contraceptive, I don't know how true it is. How true that is, sorry.
Yeah, that's another method that like our women, our mothers and those elderly women, those women who were before us, but now due to the global warming, the food that we are eating, it's no longer effective. But some ladies, when they are breastfeeding, exclusively breastfeeding for a period of 6 months since when they delivered, they don't even have their periods. Well, for the first 6 months you might miss your period, and if you don't have your period, meaning that probably you are not fertile, right? Does it necessarily mean that you're not fertile at that time, but there's some time when you get maybe you missed your periods for the first 3 months in breastfeeding, and then you think it's normal, the 4th month you get pregnant.
Ooh, how soon can you get pregnant after giving birth?
After 2 months.
After 2 months. So that brings me to my other question. After how long should I put my contraceptive after, a cesarean section and a normal birth? Just giving birth. After how long? Okay, the IUD, you can immediately you've given birth. You can be given, if it's normal birth, you can get the IUD contraception. The others, the COCs, the injectables, though we don't advocate that, because they cut the supply, the milk supply from the mother. It's hormonal. The one that the implant. No, not the implant. Even the implant affects. But not really. The percentage is not that high as the 3 months family planning. I think the injectables, I don't want to say that it's a bad method, but I think it has more side effects than every other. Which is the best? The best is IUD if you're faithful. IUD, the copper, the one that has a T-shape. It's non-hormonal. It's non-hormonal. It does not affect your period. Doesn't affect anything. It doesn't affect your weight. But remember, it's different for every woman. Whichever you prefer and it's working for you, go on, girl. Just go for it. So pale hivi Ephraim Maina, thank you so much. Ephraim Maina, Showtime Studios pale wanasema great show, very educative. Please keep those comments coming in. Pale hivi Facebook, make sure that you have commented can ask as many questions as possible. Tell us which method do you think works best, and also tell us the myths and misconceptions about the contraceptives. Pale hivi, so let's talk about culture. There's those cultures that say that they will stop a woman from having contraceptives. We've had stories of women who have gone to the gynecologist, and then they come out and say, my husband went akaritoa kwa nyumba and stuff. Yeah, you get those kind of grossy stories.
Yeah, we get them.
So maybe you can tell them something about the importance of contraceptives.
The importance of using family planning and getting kids, it's because you're going to space your kids. Your woman will get back to her health, and you financially and psychologically, you'll be ready to get another kid. You'll have a plan.
Yeah.
Maybe after 3 years, that's when I will get my next child. Then you'll invest. This thing of getting many kids, and then you're like, hey, I wish I knew this would happen, and you love the burden. Yeah.
Okay,
so in these economic times, tough economic times.
Yeah, exactly. It is good that we have the best, a good family planning. Okay, we are not really forcing people to have it, but it is very, very important because it helps us plan for our future. Maybe the last one before we wind up the show, you can tell us about the age. So we find there are teenagers who are actually going for family planning.
Yes.
Are they fit enough to have the family plan? Is it too early for them? And what is the limit? Is there an age limit for us to use contraceptives? Maybe nikifika like 40 something, I'm not supposed to use it. But mostly I want us to learn those girls who go for family planning very early in their lives, when they are like, they're starting their period, probably they are sexually active. They even parents who would even tell their kids, what, it become too much, let's go get it. How fit are they to have it?
It's not advisable because the girl is in her puberty. That's when her body is changing. Nothing is constant in the
hormones are blowing up.
Hormones are blowing up and some switching off. So the girl, she's not that ready. But there are some we call young adults. The ladies, the girls below the age of 18, but they have kids. So we advocate as the government of Kenya, they can get family planning. And now the other ladies who can get family planning for free with no many questions. Why, how, from 18 years.
From 18 years is okay, because I think
it's okay.
By then even psychologically you are grown. You can imagine a 13-year-old with an IDU. They've already started their periods. They have their mood swings and all that, and now you add more hormones. So it is good that young people out there, please take care of yourself. So maybe you can tell us about the programs that you have in your facility. Tell us, where can people get you on advices on contraceptives, and if they want to have contraceptives put in them, where can they find you?
Okay, in every health center, in every government health center, and even private health center, and also private organizations like the Maristops. They offer family planning methods and processes. So, and to add to that, on Thursday 17th this month, in Omagana Health Center, I'm calling upon all the ladies or the girls. We are having free family planning. You are going to, if you want the IUD.
Oh, really? That's the yes. Oh, wow.
17th. We are going to have those family planning experts and practitioners. They are going to give us free family planning options and advice, and every method of family planning you wish to be offered, you can come. And you men, please accompany your ladies as they're coming to get their options.
Okay, so that's a date on Thursday, guys. The government of Kenya, thank you so much. We really appreciate our government for taking care of our women, helping us to plan for our future. So Pale, Palevi Thursday. That will be on 17th, right?
Yeah, 17th.
August, there will be a free family planning, counseling, and free family planning giving to women. So if you want if you want the IUD, if you want the implant to be for free, Palevi Magana Nyeri.
Yes, Magana Nyeri, Teto Sub-County.
Teto Sub-County. Thank you so much. Social media handles zako to keep wind up the show.
Social media handles zangu naitwa Wachera, naitwa Shane Macharia. That's how I call myself in Facebook.
Yeah.
Yes.
Okay, Shane.
Yes.
Asante sana. Thank you so much, my wonderful audience. I can see my director is telling me something. Okay. Palevi Facebook. I can see Simon, but we'll read out those comments later. Naona ni kama like pale hivi ile mtandao inafanya ile kitu, but I think maybe we shall read out the comments next time, and of course we are going to answer them after the show. So sijali kama uko na swali, make sure you like put it there. Tutakujibu anything you want us to answer you on this show. I have been your host, Wachera Gikonyo. Thank you so much. This is Showtime TV. For many other shows, manze, I'll see you on the next one, guys. Stay safe.
Do you want to feel free at least sometime? But sometime you don't know where, when, how. Worry no more, enjoy the finest luxuries. Without the hustle of, who will be driving, who will drive back. Specs Tours will worry about the drive. Books your car now. 5-seaters available. For 5,000 shillings 6 hours, 7,000 shillings 12 hours, and finally, 10,000 shillings for 24 hours, all inclusive of a chauffeur. Call us on 0112 175 140 or 0740 509 086 to book now.